Good afternoon. Welcome to another lovely session. Hope you enjoyed my colleagues live yesterday, did you? And even though I was not able to wish you all a very happy Easter, hope you had a lovely time, is it? So welcome to another reading session with me, 𝐿𝐻𝐻 James. Welcome to 𝐕𝐻𝐻 Academy Reading Live. What are you all up to? What did you do? Tell me. So eager to know what were you all up to? What did you do? What are the things that you were doing and all those things? Did you all see those lovely students who have made to their dream? We had another more than 100 of students who made to their dream those last results which came, isn't it? So all those gorgeous students, and I hope you all saw the winners meet as well. They were all so happy, isn't it? So that's another beautiful thing that to see all those students who have made to their dream. Right. So yes, we'll take you to another session. Sharanya Rakesh, good afternoon. Tangasudha, good afternoon. Abhirajan, good afternoon. Lot of known name. And what do we have in store for all of you in 𝐕𝐻𝐻 Academy? Nisha Keynes, good afternoon. Shiny VS, good afternoon. Kavita Balaji, good afternoon. Angelina Mol, good afternoon. Lot of known names. Yeah, very sweet of you all to enter on time. Coming up with those lovely participation. That's which is at most important, isn't it? The way that you respond is how we would be able to. Merlin Eric Anil, new name, but I know that it is number one, so yeah, fair enough. Abhirajan, good afternoon. So is there anyone who is attending the live for the very first time? If so, please do let me know. It's just to, for me to know. I love to say I have known people across the globe because I'm so, what can you say, honored to come and say I have known people across the globe. You name the country, see, coming from different parts of India, Sri Lanka, Maldives, Malta, Mauritius, Nepal, Pakistan, Afghanistan, different parts of Middle East, different parts of Africa, Australia, New Zealand, UK, Scotland, Ireland, Italy, Canada, America, or you say Malaysia, Singapore, Philippines, Thailand, Indonesia. I have all my lovely students spread across, isn't it? So no matter wherever I go, I'm sure that I'll meet someone there. So 𝐻𝐵𝐻𝐿𝐻𝐻, good afternoon. Salvia Pivinson, good afternoon. Tangasudha, I'm in Qatar. Now I have another student from Qatar. Like I have a lot of students from Qatar, so I have another student who's there from Qatar. Gia Maldives, Annie Matthews, good afternoon. Arunima Varghese, good afternoon. So nice to see a lot of no names. Okay, now what does 𝐕𝐻𝐻 Academy has in store for you? We do give training for an array of exams. Okay, I'm familiar to. Okay, how are you? Familiar to your classes? Little name change. Okay, fair enough. That is the only reason I was a bit. It is not some name that I have been used to pronouncing or saying. Fair enough. Right. So we do give we do give training for a lot of different linguistic exams. So if you are one amongst the many who want to know what are the exams that can be beneficial to you, what are the things that can make you reach your dream country in no time, you're always welcome to call the number on the screen. They'll be happy to assist you. And please be aware, you're watching an online live. There are n number of fraudulent people available. Okay, so if anybody messages you saying that, okay, do that, do this, contact me, contact that, please report them, please block them. Okay, we will never message you for any reason. That's why we said, if you have anything that you want us to clarify to you, just call that number, 974-7944-374. That's the only contact point for you with us. Okay, if there is anybody who's saying send that mail, send this mail, just ignore them, report them, block them. Alright, Smita Johnson, good afternoon. Jilmi, good afternoon. I would definitely request, if you have not subscribed to our channel, if you have not yet liked our page, if you have not yet clicked the follow button, please do click so that you will never miss any insights that we want you to be noticed or notified, please do click so that you will not miss the live session, you will not miss the grammar questions, you will not miss, because we have been, ever since we started 2024, we've been into a lot of different live sessions, isn't it? You wanted us to take listening, we have come up with listening. You wanted us to give insights on writing, Neetu madam is coming. And you wanted us to give insights on speaking, we have come, our colleagues have come. Reading, we have lovely sessions taken by different faces, so that you get a different vibe every now and then, so that you will never feel bored seeing my only face, isn't it? So yeah, fair enough. Manju Satish, good afternoon. Smita Jansen, good afternoon. Sanita Sabu, good afternoon. So I would definitely request all of you, it's so nice to have at least one icon. All the students, most of the students, have at least one icon next to their name. It can be number one logo, it can be a heart shape, it can be a hand, it can be a flag, it can be a share button. It's all because of your love and affection that we have, or we are at the place where we are. We are at the epitome. We have no doubt, because our students are our patrons. You check our Telegram page, we are always hovering close to 50K now. Okay, if you really look into the very same page that you're watching every time, the followers are increasing, the like button is increasing. So what else could we ask for, isn't it? It's all because of you lovely students. Sini Nikle, good afternoon. So is there anything that you want me to let me clarify? Please do not hesitate to comment, because even though you're there right in front of me, it's virtual. So please look into the aspect of typing. Okay, please do post your valuable feeds. Please do post your valuable comments. Please do post your valuable questions. Okay, would be very happy to address it. Alright, is there anyone who's attending the live for the very first time? Anganarenglundo. Adyamayitte live attending. I know that there is not much of a very unfamiliar name that I've called out so far. So I think, yes, most of the names are very much, what can we say, known names for me. Right. So what are the things here? We started 2024 by giving you a few insights on the aspect of how to tackle Part A in 8 minutes, how to get 20 out of 20 in Part A, how to score 400. And Amrita Judesh, okay, so yeah, the material is on the screen, so I'll be the one who will be monitoring the time. So please do the time, and I will be the one who will be monitoring your time. So then we will discuss, okay? So please do. I'm just going to keep the timer for 2 minutes. Right, time just eludes us, isn't it? It just goes very quickly. So, even though, yes, Amrita, you've told that you knew, so happy. May I know where you're from? Ratin VR, good afternoon. Alan Maria Jomun, good afternoon. Nikita, yes, sir, first time attending. Nikita, so sweet of all of you to say that, yes, you've attended for the very first time. Okay, may I know where you're from? Shanita done, Shiny done. Alright, good enough, good enough. Okay. Lima Thomas, good afternoon. So nice. See, at least most of the students have at least one icon next, isn't it? Good enough, good enough. Right. So I would definitely, no, it's not mandatory that Amrita, I'm from Kozhikode, okay. Good enough. A very known place for me. Very nice. Abhirajandan, Manisha, hi, good afternoon. Nice to see all of you. Kavita Balaji Dan, good enough. Right. So, as usual, my question remains the same, isn't it? What is your answer and where you got that answer from? That where is the most important factor. You have to let me know where you have found the answer. Not just the answer, where you have found. Atanga Sudha Qatar, Hina Jose, good afternoon. Hina Dan, excellent. Now tell me, what is your answer and where you got that answer from? That where is the most important factor. Why? Because our job as trainer, or what we believe with Neetu's family, is we want to make sure that we are correcting from where you went wrong, if at all it is wrong. If it's right, we are here to appreciate you. 𝐿𝐴𝐚𝐲 good afternoon. 𝐿𝐴𝐚𝐲 done. Okay, fair enough. Now do tell me, where did you get that answer from? Merlin A, second last sentence. Okay, fair enough. So I have my first insight about the answer is, Merlin is saying it's A, second last sentence. Tanga Sudha is saying no, it is B from the last part. Okay. 𝐺𝐼 B from middle part, Shiny C from first line and the gist of the para. Now am I happy, isn't it? All those three options are there, A, B, C, and all those three have been told by my students. So why is that? See, we will get different answers depending on how you read, how you comprehend, how you understand. Okay, there are different things that you have to really look for when you're doing in these kind of multiple choice questions. Shanita Sabu, A first para, Arunima, A second last line, Jilmi C from the whole para, Grishma Devasya, A from the last sentence. Okay, so most of my students, out of whom have commented, are saying it is A, closely followed by B and C. Yeah, Angelina is saying done, C from the full para. Right, excellent. So I want all of you to comment. Okay, see, please do understand what is the purpose that you're sitting here for, barring the fraudulent people. Okay, see, there are fraudulent people out of whoever is watching. There are fraudulent people who have no backbone. They are here to rip somebody else's money. Okay, so not bothered about those kind of people, but people who are here with a purpose. What is your purpose? I'm here to make my difference in my life. If you are one who is saying, yes, I'm here to make that significant difference in my life, I want you to comment, whatever is your answer. Because now you don't have a problem. Why? Because all those three answer options are there. A, B and C are there. So why do you worry? Okay, it's not about what others think about whether, it's not about what I didn't get the answer by somebody else. It is you. Okay, I want you to start telling to yourself, my purpose of attending a class is to improve what I am. That's it. Not for anything on the aspect of what others. Alright? Fair enough. Grishma A, last sentence. Angelina, okay. Hina C from whole para. Sharanya C from overall gist. Annie Matthew C from the whole para. Okay, now I think A and C are almost on an even proportion, isn't it? It's almost same. Right. Now what are the things that you have to really be cautious? I always believe on the aspect, what are the things that you have to be cautious about when you really look into? So first and the foremost important thing is, you have to know each, reading, it has three parts, part A, part B and part C. Each part have its own reasons why they have framed it. So because it's B, we start with. So first and the foremost important thing when you're doing B is, you need to do three things. Okay, I want you to start repeating it to yourself so that it comes as a routine for you. One, read the question. 2, as you read the question, underline the keywords in the question. 3, understand the question. You have to do these 3 things mandatory. Because if you don't read the question, then I'm not saying it's reading the question. I've emphasized on the aspect is to manage time. To underlining question is you have to make sure that you're underlining keywords, so that every time you don't need to read the whole question. You have to just look at those keywords and see what you are really looking for. Kavita Balaji, C, second last para. Sandhya Nayak, Bank, Karnataka, no? Good afternoon. Shiny, read the question, understand the question and mark the keywords. Very sweet of you, Shiny. Thank you very much. Deepthi Prabhakaran, see from the whole para. Deepthi Prabhakaran, a new name. Okay, good enough. So again, I've told you, read the question, underline the keywords on the question, understand the question. Okay, and these keywords, see, keywords, you are not supposed to underline big sentences and all. Keywords should be very standalone words, that when you look at that word, you understand the whole question. Those are called keywords. Okay, and keywords should not exceed more than 2 to 3 words, depending on the length of the question, but most of the time it's 2 or 3 words of maximum. Okay, and the strategy for doing part B is called elimination method. Okay, I'm just going to show how things would look into. According to the directive, health professionals, now see, professionals should have access to. Now see, these are kind of not closing, isn't it? They don't have a question mark or anything. So in these kind of thing, you have to relate it with your answer option. Should have access to exposure management packs for addressing sharp injuries, access to new staff orientation induction program, access to immediate and extended management of injuries. So these 2 are talking about injuries, these are talking about some new staff orientation. Okay, this is how you should differentiate. Okay, that comes to you with the thing called habits. You have to have reading as a habit. Now go and read. Do not skip any words, do not skip any sentences. Sharp injuries post-exposure management drive. So this is definitely talking about sharp injuries post-exposure management drive. Healthcare workers who incur a sharp injury requires expedient, timely, considerate and knowledgeable post-exposure management. So they are saying, yes, healthcare worker who are prone to get sharp injury should have expedient, okay, something which is very quick, timely, considerate, knowledgeable post-exposure management. So expedient, immediate, extended management, yes. So for me, the first sentence gives you a slight indicator saying that this is C, not confirming. The basis of such management would be in accordance to, so which management? Post-exposure management, in accordance to with PD 2005-311 HIV, hepatitis B, hepatitis C management of healthcare workers potentially exposed, the key elements of which are. So these are all about what? The management. Understood? So it's not just exposure management, it is post-exposure management. That's where you have to really underline the keywords. Now, rapid assessment of an exposed HCW healthcare worker to ensure the timely administration of post-exposure prophylaxis PEP when appropriate. Availability of assessment and management over 24-hour period, and the process of reporting and post-exposure management being made to new staff during orientation and induction program. So is the whole directive of new staff orientation and induction program? No. You people who have got B, they are only referring with keywords. Referring keywords will not give you answer. So this is a straight eliminator. So they are saying the process of reporting and post-exposure management be made to know. See, it's not health professionals should need to know the new staff orientation and induction program. They are saying in that induction program, they should be aware of such kind of process of reporting and post-exposure. Understood why this is a straight eliminator? So B is eliminated. Now, exposure management packs should be developed and made ready for distribution to healthcare workers and source patients in the event of sharp injuries. So exposure management pack for addressing sharp injuries, no, they are saying exposure management pack should be developed and made ready for distribution to healthcare workers and source patients. So it is not the directive to health professionals should have access to. They are saying exposure management pack should be given to staff as well as to the patient in the event of sharp injury. Okay, for addressing, no, this is not what they mean. So this is also an eliminator. Okay, so staff nominated to manage exposed HCW should receive specific training in BBB, blood-borne virus disease processes and counseling. So according to the directive, should have access to immediate. So healthcare workers who incur a should require expedient, timely, considerate and knowledgeable post-exposure, and all those things that is mentioned is to show immediate and extended management of sharp injury. So people who have got C, absolutely good enough, congratulations, that is your right answer. People who have got A, not exposure management packs for addressing sharp injury, they should have, they are not saying like that, they are not saying they should have access to new staff orientation and induction program. So the answer is C. I hope you understood the way that I have explained. If there is any doubt, please do clarify. If not, congratulations on your great achievement of getting right answers. People who have got it wrong, it doesn't matter because you've been corrected. That's why you are here to do classes, isn't it? Gia understood, very good. Christina clear. Kavita dancing, good enough. Shiny was the first one who's enjoying. Angelina Mole, yes, happy, good enough. Please do understand the whole reason why we make it wrong, isn't it? A small, what you have to always remember is, please understand, A is different to B. A, yes, of course you can refer with the keyword, and you have to refer with the keyword, but not in B. Okay, still that's the reason why you have to go and see what are the reasons, what's the difference between elimination. See, elimination was the most appropriate way, isn't it? See, new staff orientation program, is it what the staff has to access? No, eliminated, done. Exposure management packs for addressing sharp injuries, where are they saying how to address sharp injuries? No. So that also is a straight eliminator, done. Immediate and extended management of sharp, and you have to always remember, okay, this is a clue, okay, don't tell anyone. Okay, you have to always remember, they will never give the answer straight like that. Okay, they'll with the same words which is already mentioned. They would not. See, if that is the case, why would they conduct an exam, isn't it? They would not. So part B is about understanding the gist about it. As what many of my students, I know when they say the word gist and all, they have gone through me. I know that. Okay, so please look into the aspect of each has its own purpose of focus. You have to differentiate. You have to start telling yourself, see, the whole ideology behind is not about keyword referencing. And you have to relate it along with the question. Then only you'll be able to understand the meaning of the sentence. See, the health professional should have access to. Where are they saying exposure management pack? No, they are not saying they should have access to. They are saying exposure management pack should be developed and made ready for distribution. To whom? To healthcare, that is to them as well as to the patient. They are not saying they should have access to that. Done. If you read the next one, health professionals should have access to new staff orientation and induction program. No, it is not at all what they are saying. They are saying it should be they should know the new staff and in the process of reporting, how to report, how to do post-exposure management. They should be aware when they are given, a new staff is given training manual. That's it. Anna Joseph, good afternoon. Sneha Matthew, good afternoon. Did you all understand? Yes? No? Are you all clear? If so, do give me a thumbs up. Let me see. Let me see how many of you have understood. And is there anything that you want me to clarify? You're always welcome to ask. See, we are all open. We are open to because you are our patrons. Because whatever that you are is what we are. Yeah, Tanga Sudhar understood Kathar, isn't it? Good enough. Shiny understood. Okay, good, good, good. I love the way that you respond. Every time you tell my students, they're always there, quick to respond. Christina understood. Yeah, I could see a lot of thumbs up popping up. Angelina, yes. Hina, yes. Jilmi understood. Okay, fair enough, fair enough. Deepthi understood. I'm so happy to see at least one icon next to you. Mridula Jose, good afternoon. Hananas, good morning. Ratin, yes. Deepthi, Joyson, Fernandez, good afternoon. Misha Vaibu, good afternoon. Reshma Arjun, good afternoon. Merlin, understood. Good enough. Hanan, yes. Grishma, good enough, understood. Jia, understood. Okay, good, good, good. Tiara was missing that flowers and all those love from Tiara. Hi, how are you? Little late to join, no problem. I do understand that you're all busy with your work, and we should be very, very grateful to each one of you because you take that time to attend and make this live a very, very, very fruitful one, isn't it? So thank you very much. Kavita Balaji, yes. Sharanya, Claire, Arunima, Clear. Okay, fair enough. Ivy George. Ivy. Think I know the name. Rosie understood. Okay. Reba Rijo, good afternoon. So if there is anybody who have just joined who are new, please do let me know that you're new and where you're from. I'd love to know where you all are from. Right, because we've done with part B. Are you all ready for part A? So today's part A is also another surgical method, isn't it? Canthoplasty. So it's also, as far as what I understood, it was a bit okay for me, but I would definitely want to know. I've told the name of the part A material. I want you to tell me how the material was and how many minutes you took to complete. Ashwati Shaktivel, good afternoon. Steffi Shaji, good afternoon. Neenu Rinto, good afternoon. Ajita Arun, good afternoon. Jilmi, tricky 11 minutes, absolutely good enough. Jilmi, excellent. Keep it up, keep it up. Good, good, good. So nice to hear that even though Jilmi is saying tricky, but I found 11 minutes. Tangasuda, easy 12 minutes, okay. Grishma, very sweet of you. Easy, 9 minutes, excellent. Keep it up. Christina, easy. Kavita Balaji, easy. 10 minutes and 51 seconds. Kavita is always very precise. She comes up with the very precise of that's called the commitment, isn't it? You're really pushing yourself to see how much are you able to reduce. Angelina, easy, 10 minutes, good enough. Christina Vagis, 12 minutes. Shiny, absolutely stunning. Very, very good. You have almost got onto the what can you say? We always push all our students to get it in 8 minutes, isn't it? So Shiny have done it in 8 minutes and 54 seconds. Excellent. Grishma, thank you. Deepthi, 13 minutes. Good enough. Jia, 14 minutes. Easy. Good enough. Kavita Balaji, thank you. Good enough, good enough. Arunima, 12 minutes. Very good. Keep it up, keep it up. Right. Lima, 10 minutes. Easy. Alright, I have few insight about... I'm not saying that all of you have told me, but yeah. Annie Matthews, 14 minutes. Reba, 12 minutes. Okay, fair enough, fair enough. It's always, within that stipulated period of time, isn't it? So good enough. Shiny, thank you. I should thank you, isn't it? You have been, regularly practicing and you're able to get into that 8 minutes, so which is good. So it's what it is, isn't it? We always say practice makes us perfect. So as you practice, you have a practice with the focus, it comes to you. Twinkle PJ, thank you. All right. Pleasure. Right. So again, I would remind you, see, you just go after the live, go into the very same page. You'll see a lot of students who've made to the dream. You'll see how much of an effort they have put in the winners meet. There are a lot of things happening with Neetu's family, whatever that we post. That's all on the aspect of making sure that you are reaching your dreams. Anita Sabu, easy, 10 minutes. Absolutely good enough. So because you have all made me so happy with your effort and time, let's go and dig it in, isn't it? I'm going to shoot the 20 ounces. I want you to start taking a pencil, tick, 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 tick. Done. And as when you're practicing, please ensure that you're practicing with pencils and printed materials. That's why we share. See, we have 2 Telegram page. One is an official �NITUS Academy Telegram page, and the other one is an exclusive reading Telegram page where you get the first-hand information. Okay, that is shared there so that you can take printouts early. If you have not yet joined, because we have a scrutinizing policy. Okay, after double checking only we'll be accepting you into that group. Okay, till that time, we are regularly posting on the very same page that you're watching and all the social media platform we are posting. Just to make sure that you are not ignored. We never ignore anyone because all of you are our students and we want all of you to reach your dream country. So let's go and dig it in with the question. So what is it about part A? So part A, you have to always remember there is an absolute different strategy. Okay, part A, we have only 15 minutes and you are expected to tackle 20 questions. So 15 minutes, 20 questions without an appropriate strategy, you can't. And please don't waste your valuable time on the aspect of reading each and every word and all. No way. Okay. Here also you have to understand the overall gist about it and you have to do a strategy called skimming and scanning. So scanning, I'm very much sure that you all know what is scanning. It's absolutely detailed looking. So detailed look is not when you read, okay. First you have to skim. That means quick look. So how much time can you take? Even though 15 minutes, you are expected to skim in 1 to 2 minutes. But I would say 15 seconds each text. That's enough. You have 4 texts based on one common thing. So each text will be different to each other. Text A, text B, text C, text D. And as when you skim, you should know what is the difference between text A, what is the core gist in text B, what is the gist in text C and D. If you can differentiate, part A is a piece of cake, because then after that is only keyword referencing. So what are the things that you have to underline? Okay, so we have done an exclusive video on the very same page that you're watching. After the live, go back. And the clue is that will be the live session which I have done, which has the most number of views. Easy to find. Yeah. So Jasmine Michael, good afternoon. Nice to see. Okay, no names. Yeah. So just to because just as an Easter gift, I'm just going to repeat what are the words that you're going to underline. It's heading, subheading, letters given in bold letters, italics, numbers, bullet form, abbreviation, proper noun, any new terminology. And if it's a pictorial representation, your headings. Yeah, these are the keywords. Now I'm just going to show you how to skim. Okay, don't read. See, don't ever do such a kind of mistake saying that 𝐻𝐿𝐿oplasty is a cosmetic surgical procedure. We don't have time to do that. Okay, so this keywords that I've told you, it should come to you naturally. You have to every time. Initially it is difficult, I'm not saying no, but as with your effort and with your practice, it will come to you naturally. I want you to start every time when you're doing a part, you should start telling to yourself, okay, these are the keywords, these are the keywords. Then when you go, I'm just going to show you how to underline keywords, okay? And see whether you understand anything that I'm going to read. 𝐻𝐿𝐿oplasty is a cosmetic surgical procedure, then reconstruct the eyelid. The procedure tighten the muscle, tendon, ligaments, connective tissues of the eyelid. You may choose to procedure tighten the sagging eyelid, reduce the eyelid, adjust unevenly eyelid, change the shape of your eye, and the term that the procedure reshuffle canthus, the corner part of the eye, and the upper and the lower eye. The 𝐻𝐿𝐿oplasty is the inferior technical suspension of the eye procedure, and the surgeon can provide. And there are 2 types of procedure: reconstruct the canthus, or the eye opposite the nasal bridge and the toward the and epicanthal in the corner of the eye nasal bridge. Done. Now, did you understand what I just read? No, it's not necessary, but I understood what. So generally, if you really look into an overview about it, what is 𝐻𝐿𝐿oplasty? What is it done? What are the reasons? How many types? Who can do that? Done. Understood? This is called gist. Okay. Then go to D. Go to B, go to C, go to D. Likewise, you have to go through all those things. I'm just going to quickly say before and during 𝐻𝐿𝐿oplasty. So what do you think this text is going to be? The overall gist will be pre, post 𝐻𝐿𝐿oplasty. You have to go underline, but I'm not going to waste the time so that you are. Neetu Rahul, very sweet of you to say I'm attending for the first time. I know where you're from as well. Aishwarya Hare Krishnan, good afternoon. Claudine, yes, fair enough. Likewise, go to C. So what is this C? Common drift. So any question which is related to risk of the procedure, where to go? Go to C. Understood? This is called skimming. And scanning is, then when you need something, you're going to scan that particular area. You're going to read only that particular area detailedly. That is called scanning. Understood what is skimming and scanning? Good. Likewise, see, post-operative instructions. So some instructions are to be given to people who have undergone such kind of procedure. What are those? So any post-operative instruction, guidance, guidelines. Go. After this, you're going to go to the question. Okay. See, even though there are 20 questions, there are 3 types of questions. You have to by heart this types of question, question numbers, and the instructions. You are not supposed to waste your valuable time reading the instructions and all on the day of exam. Clear? Question number 1 to 7. These type of questions are called match the following questions. Okay. Now the instruction. You have to write any of these letters A, B, C, D, and you may use any of these letters more than once. So you have 7, so definitely you have to repeat 1 or 2 letters, isn't it? Then strategy doesn't change. You're going to underline the keywords and you're going to refer the keywords. Rationale to abstain from contact lenses before surgery. So rational reasons why you're going to abstain, restrict wearing contact lenses before surgery. So before surgery, after surgery, where have you underlined? Leena Limna, good afternoon sir, attending for the first time. Hi Lima, hi Leena. May know where you're from as well, if it is okay, yeah? It's not mandatory. So before and after surgery, I'm saying it should be there somewhere in B. This is called keyword referencing. Now see, before, yes, stop wearing contact lenses for why? You don't affect measurement during the surgical plan. That's it. So the answer is B. Understood? See, what are the criteria necessitating catheter? So reasons why do you do? So where are they talking about reasons? I am sure that, because I told you the reasons are mentioned in A, isn't it? See, criteria is a plural word. Okay, you have to always remember. So what are the criteria? That's why. If it was singular, what is the criterion? Criterion is singular. You have to always, most of the students make that small mistake, yeah? So tighten a sagging eyelid, reduce the eyelid tilt, adjust uneven eyelid change. So clear. Answer is A. Jinu and Eve, good afternoon. First time attending. Very, very nice of you as well, Jinu. So welcome to all the lovely students who have entered for the very first time. Okay, I'm welcoming on all of you on behalf of Neeta's family. Would like to know where you're from as well, if you could. If you don't have a problem telling me where you are, because I love to know where my students are from. Now, negative outcomes associated with cathoplasty. So negative outcomes. So where do you think this negativity has been mentioned? Is it A? No negativity mentioned. Is it B? No, it's before and after. So definitely complications, isn't it? So C. Understood how you're going to... If your keywords, you have underlined keywords properly, 1 to 7 is a piece of cake. You can do that in a minute of time. Okay? So where are they talking about complications of all these problems? Throughout text, see common risk and additional risk and all those things are, some complications, all those things are mentioned. So see. Okay, see, you don't have to waste your valuable time the exact pinpoint or precise point of where it is. Overall. Yeah? Now, what are the alternative appellations? Appellation means names. So where is it? Names are only mentioned in A. Do you have a second thing about it? Not necessary, isn't it? Yes? So, it is known as inferior. Now, okay, my job is to show you where it is. Another term for canthoplasty is inferior retinacular suspension or almond eye procedure. Done. Now, frequency. Jenny Worg is attending for first time. Very, very nice. At least today I have a lot of people, and I know Tangasudha is from Qatar and the others I'm not able to know where you are from, but happy to welcome. One person was from Kozhikode, yeah. So yeah, fair enough. Neetu Nimmi Lukos. Good afternoon. I'm attending for the first time. Very nice. Good enough. Welcome. So frequency recommended. So frequency means definitely it is going to ask you for some range, isn't it? So frequency recommended for the application of cold compress on the eyelid. So cold compress. So where are they talking about this cold compress? Yes, I have cold compress here. Eyelid is also there. Frequency is also there. They're not asking me what is the time. So I just need to write day. Understood? So why refine the incision if the procedure is done in youth? So before and after, isn't it? So somewhere, or is it in complication? Is it in A where they are detailing, or is it in B where they are saying before and after, or is it something to do with complication? Refine. So something to do during complication. So C. Let's see if there is anything mentioned in C. Is there anything mentioned in C? Ratin, I'm from Kuwait, very nice. I'm from Kuwait, Ratin. Okay, I have a lot of students from Kuwait as well. So next time when I meet when I visit all these places, I'll come and definitely meet all of you. So where are they talking about? In C. So if the procedure is done while you're young, youth, the incision may need to be touched up. So that is a reason. So the answer is C. Technique employed to administer local anesthesia. So local anesthesia is a very prominent word. So where have they spoken about local anesthesia? So local anesthesia is only mentioned during or before, isn't it? Juni John, I'm attending from first time from Thodupuzha. Very nice. So see the diversity of the class that you're attending. I have people from Qatar, I have people from Kuwait, I have people from Kozhikode, I have people from Thodupuzha, and a lot of other students from different parts of the world. So you're attending an international class. Okay, so happy, isn't it? I am so proud to say that I'm taking an international class. So yes, the answer is B. Why? Local anesthesia, all those things are mentioned only in, for local anesthesia, the surgeon used drop or injection or numb the area. That is it. So that is the reason. Now go to the second set. These kind of questions are called short answer question, where the instruction or the number starts from 8 to 14, where the instruction is a word, short phrase, words, numbers, or both. Abhiraj 7, absolutely good enough. So what is prescribed to be worn for patient when menstruating outside post-surgery? Kavita Balaji 7, good enough, good enough. So something that they should be worn outside. So where are they talking about? So these kind of questions are definitely in after surgery, isn't it? What are the instructions? Arunima 7, excellent. So what are they saying? Wear dark sunglasses when going out when may be sensitive to light. So what are they supposed to wear? They're supposed to wear dark sunglasses. So not just sunglasses, dark sunglasses. So there is a specificity there. Okay. So dark sunglasses is the answer. It's a two-word answer. DARKSUNGLASSES. So what is the typical time frame needed for the procedure? Time frame means from 2 point. Okay, that's the emphasis of time frame. So where are they talking about all these time frame? Definitely during, isn't it? So time frame, the procedure itself takes 1 to 3. See, if you have written hours, it's okay, or 1 to 3. Anything is an okay answer. Because hours is not mentioned, you can mention 1 to 3 hours. Yeah. Insufficient maintenance of sutures post-surgery can result in complication, is it? So see, understood how you're going to talk about, or is it maintenance? Is it about management? Understood? So now this is about post-surgery. So D, post-operative instruction. So what are they saying? How long? Sorry, C, isn't it? Complication. Very sorry, just missed the question. So insufficient maintenance sutures post-surgery can result. So something to do with what? Complication, isn't it? So C. So what are they saying? Insufficient sutures are not properly cared. So what happens? You will get infection. INFECTION. Very good. I can see all of you are typing. Good enough. Excellent. That's how you should take a big role in participating. You should comment. Keep on writing your answers. Good enough. So what is recommended for patients to abstain using contact lenses following surgery? Now this is a guideline. So where are they talking about guideline? D. Isn't it? So what are they saying? Don't wear contact lenses until at least 2 weeks. Okay, so the answer is, because weeks are not there, so at least 2 weeks is an answer. Okay, so who was designated to conduct 𝐻𝐿? So definitely in A, isn't it? Because I read some surgeon there. So is there any surgeon there? Yes, oculoplastic surgeon. So 𝐻𝐿oplasticsurgeon. So question 13, potential complication manifested, that means starts in hemorrhagic condition. So again complication. So is there anywhere hemorrhagic condition? Yes, what is the complication? Bleeding. BLEEDING. Question 14, the juncture where the upper and lower eyelid intersect is called. So where is the point that when the upper and lower? So they're saying the term canthoplasty refers to a procedure reshapes the canthus. This is the corner part of the eye where your upper and lower eyelid meet. So what is the juncture? It's called canthus. CANTHUS. So the final set of questions, these are called fill in the blanks question, and you have to be very much aware. 15 to 20 is the question number. Instruction is very similar to short answer question, where it is a word, short phrase. Short phrase means 2 to 3 words, that's all, not more than that. Yeah, include words, numbers, or both. Underlining keywords are the same thing. Type of question changes, strategy doesn't change. If the intervention is conducted in your youth, so definitely we have gone through, isn't it, when we are doing in one place. Reshape touches up the incision and your skin becomes dashed with age. So definitely go where? It is in where? C. So yes, the procedure is done young, incision is touched up. As you age with your skin becomes less elastic. LESSELASTIC. Good enough. Question 16. During dash, deconstruction will occur in the outer canthus located in contrast with nasal bridge. So types are mentioned in A. Go to A. Now see which one. Okay. So outer canthus is there, corner opposite to a nasal bridge, everything is there. So what is that? Lateral canthoplasty. LATERALCANTHOPLASTY. Question 17. The surgeon will make a lateral incision positioned about a. See, now this after this definitely a consonant word should come. Of an inch from lower margin of your eyelid. So where are they talking about all these keywords? Definitely before and after surgery. So now go and see where they are talking about all these. So they are saying they will make. Who is this there? Definitely the doctors will make an incision towards the side. That's why it's called a lateral incision. We just paraphrase it. About is already there in the question. So what is the only thing which is missing? 16th, not 16. GN ko choose, not 16. 16th. About a 16th. Because the inch is already given in the question, isn't it? Of an inch, 16th of an inch. Lower margin. So SIXTEENTH. Being dashed to light is essential to dawn's dark glasses. Dawn means wear sunglasses when venturing outside. Definitely you know where it is, isn't it? So why is it? Because they are sensitive to light. So what is the word which is missing? Sensitive. SENSITIVE. The penultimate question for today. For precise surgical planning, it is advised to abstain from wearing dash for a few weeks to prevent potential disruption to manage accuracy. We just did it also. B, is it? If my memory serves right. So they're clearly saying what? Stop wearing contact lenses for few weeks. Here it is 4 weeks, there it is few weeks for measuring. So contact lenses are 2 word answer. CONTACT LENSES. The ultimate question for today, restoring the corner of an eye. Epicanthoplasty is performed to reconstruct the inner canthus synthesis adjacent to the. So epicanthoplasty, definitely go where? Hey, that's one of those 2 types, isn't it? So where are they? It is in the nasal bridge, because all the others are there. So nasal bridge. NASALBRIDGE. So I have fired my 20 answers. Now it's high time that you start telling me. If you have any doubts, please do clarify. or else please do let me know what are your total scores. Eagerly waiting to see how many of you got how much. Abhi Rajan, the first one too, make me happy. 20 out of 20, Abhi, absolutely good enough. Keep it up, keep it up. G.I. bin, seconding Abhi Rajan from Maldives. 20 out of 20, absolutely good enough. Very, very good. If you are happy, I'm so happy. Because it is all your hard work, isn't it? Good enough. I want all of you to be happy. Kavita Balaji, 20 out of 20, absolutely good enough, excellent, keep it up, keep it up. So today is a great day, isn't it? After me missing you for a few days, I'm coming and you're making me so proud about each one of you. Angelina Mool, thank you, 19, absolutely good enough. Abhirajan, thank you. You should pat your back and say, yes, I'm capable, isn't it? That's the first sign of your ability. Good enough. It's just a matter of believing in your capability. You're all able to do that. No doubt about it. All those lovely students who was there in front of me, you're able to do that. Sharanya Rakesh is saying thank you. Kavita, thank you. Jilmi, thank you. Lima, thank you. Gomati, thank you. Right, as you have all started saying thank you, it's high time that I also say thank you very much for giving me another opportunity to come in front of you. Until and unless I meet you all tomorrow, adios from